thank you very much for this invitation. Thank you very much for allowing me to share a few thoughts on this fundamental problem that is basically the title of Murad's book. You know, the pandemic is a revelation, is a sort of a epiphanic event. Tells us a lot about our economic model, our development model, and brings back the importance of health as the most precocious and the most reliable signal of the state of a social pact between citizens and governments, citizens and the economy, people and the institutions which organize their lives. So what happened with the pandemic only 4 years ago, we have kind of removed the brutal experience of the mismanagement of SARS-CoV-2, the virus, calling the virus our enemy, whereas in fact the enemy was the reasons that provoked the virus, and also the lack of cooperation and the lack of collaboration that was very evident in the beginning, and certainly in the first year of the virus. Is a sign that we have kind of removed lots of lessons that have been dispersed. But we have a huge pedagogy that we cannot forget, that we must continue recalling and bringing back, because that is the pedagogy that may allow us to change route and to, undertake a different sense of direction, a new sense of direction. Now, when COVID blew out exactly 4 years ago, many people recalled, made this comparison, made this parallel between COVID and a post-war scenario. If you remember, many people, analysts, experts, the media were also talking about this kind of post-war situation in which the world found itself after 4 decades of globalization. And it would have been good if, this post-war metaphor had been, in a way, elaborated further, historically reconsidered, and also managed in the way in which health was used precisely in the post-war times at the beginning of the 40s, when the world was completely disrupted by 2 genocides, 2 world wars, and 2 atomic bombs that had been dropped in 1 week on the same country. So the scenario of catastrophe then kindled a very strong and very visionary political intuition to the policymakers that survived all this destruction. And basically, because the world was a kind of a war hospital, the idea emerged that health and the right to health could be, in a way, the thread to pull, to reweave and reconstruct and rebuild societies. Because whichever role you had in all this disaster, if you had been a fascist, a communist, a Nazi, whatever, you, at this point, after all these disasters, you were a person, and from this disaster, health could be the only key to rebuild societies. I think this was a great intuition, and it was an intuition that was trickled down in many places. You may know that in the early 40s, when the German perhaps were bombing Great Britain. This liberal politician, Beveridge, was already projecting the fact that once the war was over, health should not be considered a luxury. Health should be, be made available as a social common, as a common good. And therefore, he already envisaged these ideas of a national health system that should be universal. It should be free of charge for all, and it should be funded through the taxpayers system. This was the idea of health as a fundamental human right that also characterized very much the 3 years of negotiations that were needed to create the World Health Organization from 1946 to 1948. And when the World Health Organization entered into force on the 7th of April of 1948, the first article of its constitution actually enshrines the constitutionalization and the first institutionalization of a human right in history, at the global level, of course, at the international level. The first right that was institutionalized and that became a binding obligation for governments is the right to health. It anticipated all the other rights that are enshrined in the Human Rights Declaration released in December of the same year, 1948, by several months. And we all know that whereas the Constitution of the World Health Organization is binding now for 194 countries, still today, the Declaration of Human Rights is a declaration. It is not a binding instrument. It is a very important statement of principles. So what I'm saying is that health has been used as the key to open and to start an agenda of human rights in a post-war period. It is thanks to this intuition about health and the conditions which enable health that are very beautifully, I would say, spelled out in the preamble of the WHO Constitution. Health entails cooperation. Health is based on solidarity. The right to health is a pillar for international solidarity and a sense of relation that should be established among people, but also among states. Health is a condition for peace, and it is an instrument for creating peace. Health is not really much to do with medicine. It's so much more to do with a condition of personal freedom, personal capacity to participate in society. Health is a status of responsibility that each person exercises in his or her own society, in his or her own life. So, as we know, health has been defined by WHO not as the absence of disease, but as a complete state of psycho and social well-being, for which states are obliged to create the conditions. And in many constitutions, this idea of the right to health as a fundamental human right, as a basic human right, has been articulated. Today, there are at least 125 constitutions which basically spell out in clarity the right to health in their constitutions. If I just may make a little parenthesis on the Italian constitution, which was created after the war exactly in parallel with the UK creation of the national health system and the international debate at the World Health Organization. The right to health in the Italian constitution is the only article that doesn't speak about being a citizen to be entitled to that right, but it is a right that every person who lives in Italy is entitled to. No citizen required. You just have to be born to be entitled to this right, because the right to health, which is of course an individual right, is also very much a collective right. And health is a condition that does never affect one individual person, but affects communities, it affects societies overall, as we have seen during the pandemic. Now, this positive idea about health, this positive notion of health, which was built on solidarity, on knowledge, on empowerment, on freedom, of democracy, has been lost severely during the last 40 decades, I would say. Of course, I don't have time to elaborate the whole history of the right to health, but what I would like to say is that, especially in the last 20 years, we have seen a swift transition from a move that could recognize positively this right into constitutional instruments to what I would say, I would define the marketization of the right to health. And we are now in a further stage, which we could be calling the financialization of health, the financialization of the right to health, meaning that we are at a time when health is primarily driven by not only profit motives, but speculative motives, not only by privatization, but by the influence and the intrusion, completely uncontrolled, completely unregulated intrusion of financial institutions, financial actors, financial motives, financial policies, financial visions that are associated to the right to health, because health is life at the end of the day. And in a time of polycrisis, in a time of emergency, as we today are after COVID-19, financial actors, financial players have really discovered that this immunity paradigm that we want to build after COVID-19, this idea of a global health security agenda, gives them a fantastic, unprecedented opportunity to speculate on people's lives and on people's on people's rights as well. So, what we can see today is the fact that the world is negotiating at the World Health Organization a treaty, a pandemic accord. The international community is trying to decide and to design the future management, the seemingly improved management of the pandemics that will come in the future, as if a pandemic were, an epidemiological event and not a policy failure. Anyway, they are trying to figure out how to improve the management of the future pandemics, basically using exactly the same failing mechanisms and the same failing governance that we have seen during COVID-19. In other words, they are basically imagining that the future pandemics will be the responsibility or managed by a series of public and private partnerships, which are de facto entities of private law, which are composed by the corporate sector in its, for-profit and not-for-profit variant, meaning the companies themselves and the philanthropic actors that are still part of the private sector, and that these public and private partnerships will deal with their presumed knowledge, competence, outreach capacity, financial ability to resolve the problems of the future. This is a very concerning outcome that with a group of as Geneva Global Health Hub, we are trying to, contrast as much as we can, because COVID told us exactly, I mean, the pedagogy of COVID-19 gave us exactly the opposite type of information, that health needs to be public, health is a state responsibility, health is a human right, health is health provision, healthcare is and must be predominantly within the public health sector, which has to plan, which has to prepare, which has to prevent diseases and prepare and organize itself and its personnel, health workforce, to deal with emergency events or with health crises. And unfortunately, this is not the sense of direction that we are getting. This is not the way that we see things unfolding, because health has been transfigured by corporate sector. It has been completely transformed, both in policies and in the political culture that is around health, being over-medicalized, being primarily conceptualized according to diseases, and being mainly projectified. Today, it is projects around health that are winning, and not policies around health that are having the major attention. And especially, health is more and more shifting from the WHO, the World Health Organization, into the hands of, as we have seen during the pandemic, the World Trade Organization, that is not even introducing a clause of international law like intellectual property waiver. And it is increasingly shifting to the World Bank, which is a financial institution, just to confirm what I was saying earlier, whose main purpose today is to leverage the private sector and actually using the public money to de-risk the private investments, which are looking at health as a fantastic opportunity for creating new asset classes, creating new financial products, creating a new round of business and speculation. This has a huge impact on the right to health. We have seen, that there have been recent reports. I can put them in the chat, or you can contact me and I can share them with you, after this meeting. We've seen the report that Oxfam published last summer, called Sick Development, basically telling us through the real life stories of people in Mozambique, in Kenya, in India, in Uganda, what this financialization of health entails, what it means when private actors, private for-profit actors, use the public money basically to fill their pockets. This is a devastation that we now see as the mainstream, agenda that unfortunately the WHO seems to be, and governments, by the way, and even governments that surprisingly are accepting this game, like Brazil, for example, which Lula's Brazil, which is now apparently trapped in this idea that we need the pharma companies, we need the private sector to do things to avoid the future pandemics. Now, it is too unfortunate that the World Health Organization has really gained this fixation of conceptualizing health only according to a biomedical view, and that access to countermeasures has become apparently the only way to deal with future pandemics. But we know exactly that this is not the case. And instead of looking at the negative health, which is the disease, and the countermeasure, so something that I can only use as a defense after, we are trying to push for a very difficult notion of a positive concept of health, which is basically health promotion, it is disease prevention, and it is the adoption of all those policies which are related to the development model we have enacted in the last 4 decades, that actually through food systems, through energy policies, through the fossil policies that we have adopted of deregulation as well and of privatizations are producing so much damage to the health of the people globally, in the global south and in the global north. So health today, and I close here, is a kind of a mirror, I think, of the past policies that we have adopted, especially over the last 4 decades, but also it's a mirror of how hypocritical and how bipolar, in a way, we are when we talk about sustainable development. And in fact, we continue pursuing the same policies that are not only fossils, but they are toxics, they are murderous policies, they are necrophile policies, as some of the African analysts call them, that are actually, in a way, creating the conditions for which humankind, for the first time in its history, is literally counting the numbers of the years of our survival on the planet. So the health of the human beings is absolutely connected to the health of the planet. And we need to regain, even as civil society, this positive concept of health, but also the positive courage to really, not accept, micromanage little reforms when we talk about health now. This is time for what I would call a strong reaction and a strong exercise of truth about the right to health. Thank you.